That was like a blur. I was in a panic when he had to come to the emergency room, because something that you think is just as simple as heartburn, and now my baby's going to the ER. That day, it was just like, oh, yeah. AJ was dealing with some type of acid reflux, which we thought it was acid reflux that was caused by something he was eating, maybe dairy, maybe spicy foods. And even after kind of limiting those things, he was still having the same reaction.
It felt like it was like stuck, like I could feel like the pressure like inside my throat. It will make me want to eat less. Like I used to get like these like milkshakes, and I would just drink those, but sometimes they would stay down, sometimes they would go down.
We took him to the doctor, and they said that he had a lower GI issue, so he had a compaction. We thought once the compaction was gone, everything would be back to normal, but he was still having issues. That's when I realized he had lost like 12 pounds. I'm like, when did he lose the 12 pounds? Something's not right. He went over to my mom's home and stayed the night there, and my mom went and got the kids pizzas, and he said that he was dealing with some type of heartburn. Well, it had got to the point that he said that it was just hurting too bad to stand on his feet. So my mom said, well, I'm not taking my chances. We're going to the ER.
AJ was admitted to the hospital in Little Rock with these severe symptoms and ongoing weight loss. The nurse practitioner on service did an upper GI x-ray to look at the anatomy of the upper intestine, and the anatomy looked abnormal. And so at that point, she contacted me. She said, hey, I suspect this disorder called achalasia. Based on these images, let's coordinate, make sure we do what's right next and get everything done efficiently. Basically, we have a feeding pipe that goes from our throat to our stomach, and that feeding pipe stops working in achalasia. It stops working because the nerves and the muscles that coordinate everything to squeeze the food down, they gradually lose their effectiveness. They gradually lose their squeeze. And just as importantly, the barrier between the feeding pipe and the stomach stops relaxing, stops opening. So you can't push the food down, and it can't get through the hole, so it kind of backs up and gets stuck. And patients will get chest pain, symptoms of reflux. Frequently they'll have vomiting because things just back up, or they'll just stop eating because it doesn't feel good. The gold standard test, once the initial suspicion of achalasia comes up, is esophageal manometry. So it's a very specific test with a tube in the nose that measures muscle dynamics and pressure in the esophagus and just past the esophagus. The manometry results for AJ were classic for achalasia. It met the two main criteria for what's called a major motor disorder of the esophagus and fit the pattern of achalasia.
I was just glad I had the camera on my nose. It didn't really hurt. It just I just felt the little pressure.
For AJ and for anybody with achalasia, there are options for treatment. And after diagnosis, there's a discussion to be had. It requires treatment. Treatment is always an intervention, so there's no medicine that can make it better. And we actually don't know how to fix the esophagus and make it squeeze. So what we do is we try to open up that muscle that's blocking the food from going to the stomach. And there's two main ways to do that in kids. One way is to stretch the muscle with a balloon, and that's something that a GI doctor or a surgeon can do. The second option is called a myotomy, which is a surgical intervention where a surgeon would actually cut that muscle that's blocking things up and let it relax, open it up, so physically things can go through better. And in AJ's case, they decided for a primary myotomy, a surgical procedure, which was very appropriate and met their needs.
After the surgery, he was gaining all of his weight back again, and his energy level was tremendously different. They said that he was good to go. He can live his life as normal. Thank God.
He's actually back on track with his weight. He also said that he was able to eat comfortably, which is why he was gaining weight. And he didn't have the same chest symptoms that kind of led to his hospitalization in the first place. So really, he's had a great outcome.
The nursing staff took amazing care of AJ. The entire time that he was here, everyone was answering every question I had to ask. I would definitely recommend Arkansas Children's Hospital.
I remember this one lady. She had this white headband to pull her hair back. Yeah, she always gave me ice cream. She gave me video games and stuff. She was my favorite. She was my favorite.